Good afternoon. Thanks for coming out this afternoon. We're going to do something a little different, slightly different format, and I hope you appreciate it. We've had some internal discussions in our office the last week or so about when to have something like this, and just to pull together some professionals from the healthcare community to talk about Corona. It seems like now is as good a time as any to start that. So we've been having some discussions this afternoon with leaders from the health department and our two healthcare facilities, talking about Corona, but also talking about really the most important thing that faces us here in Evansville today, and that's the flu. And no, I am not suffering from the flu, even though my voice is a little groggy, and I'm not contagious, so everyone can relax. One of the things we want to do is to make sure people know and encourage people to seek reputable sources for information. We believe the Vanderbilt County Health Department site has the most up-to-date knowledge or information. The hospitals will have that. They'll all be following the lead of the CDC and the health department. So, but if you can go to the Vanderbilt County Health Department website, you'll see the latest, most reputable information, and that's what we really encourage people to do. And not take a rumor that you hear over the water cooler or hear something in the grocery store as gospel. This is the information on this site that you can really count on. Having said that, I'd like to turn over to Dr. Ken Spear. Actually, I'm going to have everyone introduce themselves. Again, this is going to be a little more informal than usual. Cliff, we'll start with you, and then we'll work our way around, and then Dr. Spear will start with a few remarks.
I'm Cliff Weaver, EMA Director for Evansville and Vanderbilt County.
I'm Dr. James Porter, the President of Deaconess Health System.
Dr. Ken Spear, Vanderbilt County Health Officer.
You know me.
I am Dan Pratt. I'm the President of St. Vincent Health System.
I am Dr. Heidi Dunaway. I'm the Chief Medical Officer for St. Vincent.
Hello, I'm Beverly Walton. I'm the Executive Director for the Community Patient Safety Coalition in southwestern Indiana and Kentucky.
Okay, Ken.
Okay, thank you all for coming. I think my big part is share facts, not fear, and that's why we're putting together this website with all of the up-to-date information from Indiana State Department of Health and the CDC, and we're trying to keep it up-to-date every single day. We're adding to it and increasing the amount of information there. The health department has always been kind of like the source for vaccinations, and since there are no vaccinations for this, we thought we'd really vaccinate the brain with good information and try to keep people from panicking over this illness. And one of the things, we had already planned a flu pandemic exercise in March, and we're going to go ahead and continue that as planned. Again, it'll be more to share information, so that's all.
And just to be clear, that was scheduled before?
That was scheduled a long time ago.
Yeah.
That's part of we have to do that every year for our preparedness grant, so.
So maybe the hospitals will jump in about the biggest health challenges facing us today, seasonal flu.
Yeah, let you guys do that.
Yeah, so which is a challenge in that it's flu season, so lots of people are having illnesses that may cause upper respiratory symptoms and fever. And like the flu, coronavirus causes fever and upper respiratory symptoms and sometimes shortness of air. There's no evidence that we have coronavirus in our community today at this point. Certainly we need to continue to watch the public health information to determine what happens in North America with regard to the novel coronavirus. But the things that people need to do are, number one, get good information. Don't necessarily listen to social media and believe things on there that may not be based in fact at all. We agree that the Vanderbilt County Health Department's website is one of the best places to get the most up-to-date information that will then link out to other national sources of information. If people have symptoms of an acute illness, the best thing to do is not infect other people. So stay home. Don't go out if you're feeling ill. The vast majority of people, even with the COVID-19, this novel coronavirus, have a mild illness. And if they'll just stay home and stay away from other people, they won't spread it around and infect other people. And that's the most important thing worldwide for us in terms of this thing coming to an end, are the public health measures associated with people not infecting other people. If we do start to get it in the community and there's concern about that, then what we would still like for people to mostly stay home, read the information, and if they have symptoms that they believe are reason for concern beyond mild symptoms, then they should contact their healthcare provider, but don't necessarily run to the emergency room or run into an urgent care center to your doctor's office. No need to expose other people if you have just symptoms that there isn't really to do much about. I think one thing we would like to emphasize is that we're preparing for this all the time as health systems in the community. The world we live in today is such that there are highly communicable new illnesses that come about from time to time, and so we're constantly preparing for it, making sure we have the right supplies to take care of people, planning for what would happen if it did become more prevalent in our community, and we coordinate those efforts both through the Patient Safety Coalition and other groups that we work together with on a regular basis. So there's really no need for people to be particularly concerned in our community, certainly at this time, and we'll just keep an eye on things and see how it continues to develop as the days and weeks continue to pass here.
I think it's important to know too that we are still under some flu restrictions at our local hospitals. So regionally, we have a group that comes together through the Patient Safety Coalition and in coordination with the health department to plan that each year. When we start seeing flu activity increasing, we put some influenza restrictions in place. And so we ask that we limit the number of visitors coming to see patients. We also restrict by age. So we are not allowing visitors under the age of 15 to reduce the risk of transmission of influenza. But these are also some precautions that if the coronavirus would come into our community, we already have these restrictions in place and they will help with reducing the spread. There are a lot of folks out there that I think are going out and grabbing as many masks as they can or thinking that might be a way to protect themselves. Again, like Dr. Spears said and Dr. Porter said, the common precautions, washing your hands and not touching your face, are really the two best things you can do. And if you are sick, stay home. Masks are not going to prevent you from getting sick in most cases. Those are really there for folks who do have an illness, who do have to go out into the public or go to a healthcare facility. And that's to help prevent them from potentially being contagious to those around them.
I think the biggest takeaway from this is that we're always all collaborating all the time for everything, so that when something like this comes along, we're not left short-handed or 2 steps behind, because we're talking pretty much every week, every day about illnesses and ways to approach public health in a better method. So it's an ongoing collaboration that really is, in this area, I think is fabulous, really working quite well. So.
Yeah, just to reemphasize, unless people, if it does become more prevalent in our area, unless people have relatively severe respiratory symptoms, there really isn't anything we have to offer anyway. It's just treatment symptom like a cold, and so it's Tylenol if you have fever and a cough medicine if you have a cough. Again, feeling like you have to go to an emergency department or you have to go to your doctor's office really just increases the likelihood that you expose other people to whatever it is you have, whether it's influenza or the novel coronavirus, and there's really just no need for that. It's not going to benefit people any to seek that attention.
I think one of the things that I really wanted to get out today was a message of reassurance. It's been mentioned a couple times, but I don't think we can say it enough. The institutions at this table talk on a regular basis about how to protect our community from a potential public health crisis, and I have every confidence, as should all of our citizens, that this collaboration will win the day if need to be put into place. And everyone should be commended for their commitment to protecting our community's public health. And I'd like to reemphasize also that it's the Vanderbilt County Health Department website is the site to go to for the most accurate, up-to-date information. Ken and his team do a great job of making sure the latest information is available there. With that, we'll be happy to take some questions from anybody.
Mayor, all these folks, except for Mr. Weaver, are health professionals. Have you been consulting with anyone else in terms of the school system or any other facilities about what might have to happen if the virus gets in this area?
We have not had those discussions.
Do you anticipate that?
It depends on what happens. I mean, if the snapshot in time that we're experiencing now in our community continues, that is to say, the coronavirus doesn't come here, or isn't found in anyone here, I don't see having that discussion. But certainly there are ongoing contingency plans between all the institutions in the community. So if something happened in an urgent matter, I have no doubt that everyone could respond in the most timely and efficient manner possible.
If some of the hospital officials particularly could talk a little bit about, I know there's been a lot of rumors out on social media that health officials have had to deal with, especially locally in surrounding counties. Is that something that you've encountered here in Vanderburgh County? And if so, how have you kind of dealt with that as those rumors have come out?
So on behalf of St. Vincent, we really haven't had a lot of rumors that we've had to respond to. I think the most important thing is we really want to, again, direct people to sources of information that are accurate and factual. And so I think health department site would be a great site. I think the advice is to be wary and avoid that kind of social media that's misinformed or isn't based in fact. I think that's the most important thing as those rumors spread and just really confuse people. But we haven't had a lot so far.
Are there going to be any restrictions put in place for the local airport, or is that something that you guys have talked about, since travel right now seems to be the biggest concern since it's spreading through China and all that?
There have been no discussions of restricting anything at the airport.
We don't have any international flights coming in to Evansville, so that would be the primary reason to do it. The airports that have had screening have been airports that have international flights coming in from countries where it's known to be person-to-person spread.
No.
Some of the airlines have already put restrictions on themselves, but not necessarily in Evansville. Most of it's east or west coast.
In terms of the international flights that they're actually conducting, some of the airports have curtailed some of their international routes.
Definitely. And I know some people in the area, they travel internationally, such as Toyota. Do you know if any companies in the surrounding area are doing anything different to keep their employees safe?
I'm not aware of any.
You guys said that there wasn't any cases in this area of people that might have coronavirus or something similar to it. What would be the closest place to us that you guys have heard of someone having possible symptoms or have been tested and that was positive?
I think the CDC's website's the best place to go for
Yeah.
up-to-date information on that.
That's where the cases actually are.
Yeah.
Because right now, it looks like Nebraska, California, and where is it?
Chicago.
Chicago.
There were those 2
Chicago.
cases in
Yeah.
Chicago.
There have been some folks that the government has intentionally brought back into the country and have quarantined them for a period of time while they're monitoring them. That I think some that were on the cruise ship maybe was the biggest group.
And I think probably through both our systems, we have screenings in place in line with the CDC recommendations to screen patients who come in with upper respiratory infections or any symptoms that could be suggestive of coronavirus, and following those recommendations to see if those patients should be tested. And we work with the State Department of Health, but we've not had any concerns at this point.
Have you had to test many patients for that so far, or is that just something that you have in place in case the need rises?
We collaborate with the State Department of Health, and we have not sent any tests at this point.
The state has a decision tree around a series of questions that you go through to determine whether or not someone who might be concerned should have testing. And same at Deaconess, we've had a number of people that we've taken through the algorithm, but no one who's resulted in having a test. And that's being updated on a regular basis as parameters change in terms of what countries and things like that go into that screening tool.
Has anyone been checked out who went to China and there were concerns about maybe coming down with the virus? Because it takes some time, doesn't it, for symptoms to show?
Yeah, there's an incubation period. We've had phone calls from folks who have had international travel and wondering if there's something they need to be concerned about. And again, you know, I mean, right now, it's easy enough for us to deal with that. It would be a problem if so many people who had questions started calling our call centers and our operators and things, which is why we really, again, think it's very important. Both of our websites have information and links to it, and again, I think the best place is the Vanderburgh County Health Department's website.
Have these phone calls like clogged the system at all, or not to that point?
Not at this point, but certainly we don't want to have that happen because there are going to continue to be people that have other medical conditions that need our attention and need our care, and we don't want their care to be delayed or interrupted because we're trying to, you know, answer questions that could easily be addressed for folks in another way.
And again, I think it gets back to what Dr. Porter said earlier too. This illness for most people is probably like a mild cold. And so, you know, just merely the travel to an area where there's a higher prevalence of the virus does not necessitate being tested. It really is keeping track of those symptoms, and if you're sick, stay home.
Was there any like big event, or was it those calls that made you guys say, okay, we need to have this conversation and let the community know that we're having the conversation? Or-
We've had internal discussions in our office for several days about pulling folks together, and it's a matter of, okay, when do we do it? And again, as I said earlier, the time just seemed to be right. There was not one specific situation or one instance that said, okay, it's got to be Thursday at 3:30. It just, the time seemed right. Just because it's a point of discussion in so many circles. And we want to, again, to be crystal clear, we want to make sure that people are reassured of what the reality is in Evansville, Indiana today. And that is, there's no reason to be fearful. There are great plans in place. We have great healthcare providers that can handle this if the situation arises. And right now, it has not arisen to this point.
I mean, I think the new piece of information within the last 48 hours was the CDC's press conference where they said they think ultimately it will become person-to-person spread and more widespread in the United States, but obviously we haven't seen that yet.
You said the coronavirus almost mimics a cold for a lot of people. Aside from that quarantine period that we've seen a lot in the news cycle, would you also treat that like symptoms almost like a cold, or?
Mm-hmm. Yes, we would definitely recommend that, just the symptomatic treatment, the mucolytics, cough medicine, fever medication.
Again, unless a patient had pretty severe respiratory symptoms as a component of the illness, there isn't any prescription that's going to be beneficial to people. Everything that would be potentially helpful is over-the-counter medication.
Okay, everybody, thanks for coming out today. Appreciate it.